Not all coughs are the same, and the type of cough you have actually gives clues about what's going on in your body. Welcome back to Workday Lessons with Terrence Achua NP. Let's break down cough types in simple, everyday language. First, there's the dry cough. This is the cough that feels tickly, irritating, and doesn't bring up mucus. It's often caused by viral infections, allergies, postnasal drip, asthma, acid reflux, irritation from smoke or pollution. Dry coughs can linger after a cold and may last weeks even when you feel mostly better. Next is the wet or productive cough. This one brings up mucus or phlegm. It often happens with colds, bronchitis, pneumonia, COPD flare ups, sinus infections, or draining into the chest. If mucus is clear or white, that's common with viral infections or allergies. If it's yellow or green, it can mean infection, but color alone doesn't automatically mean antibiotics are needed. Now let's talk about the nighttime cough. If your cough is worse at night, think asthma, postnasal drip, or acid reflux. Reflux especially can trigger coughing when you lie down. There's also the barking cough often seen in children with croup. It sounds harsh and seal-like and usually needs medical attention if breathing sounds strained. And then there is the cough that should make you pause. If you have a cough with shortness of breath, chest pain, coughing up blood, high fever, confusion, or it lasts more than 3 weeks, that's not something to ignore. Also important, if you are a smoker or former smoker and develop a new persistent cough, get evaluated. Don't just assume it's normal. Here's the main takeaway. A cough is a symptom, not the disease itself. The pattern, the duration, and other symptoms matter. If this helped, save it, share it, and follow for more workday lessons. Simple health, clear answers, so you know when to wait and when to get checked. Don't just live, thrive.